Hello everyone, I'm Dr. Renato, the Water Doc Paragas. For more than a decade, I have been managing diseases without using a single pharmaceutical product, but utilizing purified drinking water, supplemented with Ionic mineral drops, and other mineral supplements. I have observed that rehydration played a vital role in managing most of the diseases that are very prevalent today. Minerals supplemented into purified drinking water greatly helps rehydrate the body. So please join me today as I discuss the medical condition known as bronchial asthma and learn how proper hydration coupled with minimal supplementation help resolve the disease. Mainstream medicine describes bronchial asthma as a chronic lung disease or a long-term disease of the lungs. The airways get inflamed and narrow and makes it very difficult for the person to breathe, talk, and being active. The mainstream medicine claims that the inflammation of the bronchial tubes with sticky secretions inside the airways causes the breathing difficulty. Asthma is oftentimes associated with allergy. Some symptoms include cough, wheezing, shortness of breath, chest tightness or pain, and trouble sleeping. Symptoms may vary from person to person. One may have different symptoms at different times, from being mild to severe. Some may experience it during exercise only, or during a viral infection like colds. The most important diagnostic measure is the history taking, a conversation with the patient, and physical examination. On auscultation, wheezes and some crackles may be heard. These are followed by instrument-based diagnostics to confirm the diagnosis. The lung function tests. The lung function tests include peak flow meter. This is a simple device that measures how hard you can breathe out. Low readings are a sign that the lungs are not working well and asthma may be getting worse. Spirometry. This is the common type of lung function test. It measures how much and how quickly air moves in and out of the lungs. Lung volume test. This measures the amount of air you can hold in the lungs and the amount of air that remains after you exhale as much as you can. Gas diffusion test. This measures how oxygen and other gases move from the lungs to the bloodstream. Bronchial provocation test. This determines what triggers asthma, such as exercise, smoke, and dust. It can also be used to measure the severity of the asthma. During the test, a medication that makes the airway narrow is taken. Then, you are submitted for spirometry test. Methacholine challenge. Methacholine is a known asthma trigger. When inhaled, it causes the airways to narrow slightly. A positive reaction to methacholine signifies you likely have asthma. Exercise stress test. This test looks at how exercise affects lung function. Lung function tests are often used to find the cause of breathing problems, diagnose and monitor chronic lung diseases, including asthma, allergies, chronic obstructive pulmonary disease or COPD, emphysema, damaged or scarred lung tissue, disease caused by inhaling asbestos fibers, sarcoidosis, lung cancer, infections, thickened, stretched, or enlarged airways, thickened or hardening of connective tissues like scleroderma, and weakness of the chest wall muscles. Check if lung disease treatments are working. Check lung function before surgery, and check whether exposure to chemicals or other substances in the home or workplace have caused lung damage. Basically, the tests look for how much air the lungs can hold, how well the air moves, in and out of the lungs, and how well the lungs move oxygen into the bloodstream. If any of the lung function test results are not normal, it may mean that you have a lung disease. The two main lung disease diagnosed by lung function test are first, obstructive diseases. These lung diseases cause airways to become narrow, making it hard for air to flow out of the lungs. These include asthma, bronchitis, and emphysema. Second, restrictive diseases. In these diseases, the lungs or chest muscles are not able to expand enough. This reduces the airflow and the ability to send oxygen into the bloodstream. These diseases include scleroderma, sarcoidosis, and pulmonary fibrosis. The classification of asthma depends on how often you have the signs and symptoms and how severe they are. Asthma is classified into 1. Mild intermittent, meaning mild symptoms occur up to 2 days a week and up to 2 nights a month. Mild persistent means symptoms occur more than twice a week but no more than once in a single day. Moderate persistent means symptoms occur once a day and more than 1 night a week. Severe persistent means symptoms occur throughout the day, on most days, and frequently at night. Mainstream medicine manages bronchial asthma using long-term asthma control medications such as inhaled corticosteroids, leukotriene modifiers, combination inhalers, and theophylline. Quick relief medication such as short-acting beta-agonist, anticholinergic agents, oral and intravenous corticosteroids. Allergy medications are administered if the asthma is triggered or worsened by allergies. I have observed that despite the regular intake of the aforementioned medications, several asthmatics continue to suffer from attack. It is so because the mainstream medicine has different perspective of what truly causes bronchial asthma. Dr. Feridun Batmanhelij, the author of the book Your Body's Many Cries for Water, defines bronchial asthma as a complication of chronic dehydration in the body caused by the body's drought management programs that obstruct the free passage of air so that water does not leave the body in the form of vapor. According to Dr. Batmanhelij, when the body is in the state of unintentional chronic dehydration, the lungs also participate in its conservation. Unintentional chronic dehydration occurs when a person fails to drink sufficient volume of water regularly. When he drinks other forms of commercial beverages, most especially caffeine-laden ones such as coffee, tea, soft drinks, chocolates, energy drinks, and sports drinks. When he drinks a lot of alcoholic beverages, and when he takes diuretics such as furosemide, spironolactone, and hydrochlorothiazide, it is best to avoid these substances to be properly hydrated. During respiration, breathing should be free and easy. As you breathe, air freely gets into the lungs due to the negative pressure created by the expansion of the chest, allowing air to be sucked into the lungs rapidly. The air passing through the airways gets into the very end part of the lungs, known as the alveoli or air sacs, the smallest passageway in the respiratory system. These are tiny, balloon-shaped air sacs that are arranged in clusters throughout the lungs. They are very thin, allowing the relatively easy passage of oxygen and carbon dioxide between the alveoli and the blood vessels called capillaries. Oxygen is distributed to the various cells of the body, while carbon dioxide is eliminated out. For the respiratory tract and the alveoli to remain patent, a complex substance known as surfactant must be present. Surfactant allows the alveoli to stay open and compliant during respiration, both the inspiration phase and the expiration phase. Without the surfactant, the alveoli may collapse during inspiration, preventing gas exchange across the alveolar wall. When the lungs collapse during expiration, it takes a great effort to reinflate them. Surfactant makes breathing easier. The respiratory organs must be moistened to prevent them from drying, especially when air passes through the airways at a speed of approximately 1 to 2 meters per second. The substance that covers the respiratory tract lining is mucus, a viscous substance that does not dry up very easily. When the mucus thins out or is absent, the rapid incursion of air may cause injury to the respiratory tract lining and causes inflammation. Just imagine your face being clobbered by the wind while riding a speeding car, which is windows fully open. Mainstream medicine describes bronchial asthma as an inflammatory condition. Proper hydration will help produce adequate amount of mucus that protects this from happening. When the body is in the state of unintentional chronic dehydration, it will trigger all the mechanisms to preserve water. It reduces the volume and frequency of urination, sweating, and elimination of water through respiration. The loss of water through respiration is observed through the water vapor during exhalation. This is very evident when you exhale onto glass or mirror. The manner in which respiratory system helps preserve water in the body is noted through bronchospasm or constriction of the airways. The muscles surrounding the bronchi tightens and causes the airways to narrow. This causes the wheezing sound and the difficulty in breathing. This narrowing, however, will allow less air to get inside the lungs. Less air getting in the lungs will carry less water when leaving the lungs. Less water getting eliminated will prevent further loss of water from the body. The wheezing and the difficulty in breathing becomes more severe when the respiratory inflammation will produce more viscous mucus that further blocks the narrowed airways. This causes the person to persistently cough, forcing the clearing of the mucus out of the lungs for the lungs to accept more air. To resolve bronchial asthma, proper hydration is very vital. This is one of the first steps executed in the emergency room for asthmatic patients. Proper hydration is 50 milliliters per kilogram body weight per day. The adult body is approximately 7% water, and so the old rule of 8 to 10 glasses a day is very erroneous. The increase in the cases of bronchial asthma may be attributed to this belief. After computing for the right volume of water to drink, this is the schedule of water intake that you should follow throughout the day. Drink 1/4 of the total daily water requirement upon waking up in the morning and at bedtime. Drink 1/8 of the total daily water requirement 30 minutes before lunch and supper. Drink 1/8 of the total daily water requirement 2.5 hours after breakfast and lunch. Drink additional 250 ml of water for every 30 minutes of any strenuous physical activity, and drink whenever you are thirsty. Drink purified drinking water purchased from an accredited drinking water refilling station or water filtered through a drinking water system certified by the National Sanitation Foundation or NSF International as Class 1 for standards 42 and 53. The major contaminants in water are sediments, microorganisms, chemicals, and heavy metals. These contaminants must be eliminated from your drinking water to avoid possible adverse health effects. Since most purification technologies eliminate the healthy minerals, they must be restored utilizing ionic mineral drops. Water without minerals is acidic and dead, and it cannot rehydrate the body properly. Magnesium chloride in ionic mineral drops relaxes the smooth muscles surrounding the airways and helps widen them. It also plays a vital role in preventing and fighting infection. This is the proper procedure of taking ionic mineral drops. If you are less than 60 years of age and weighing more than 40 kilograms, start the dosage of ionic mineral drops at 10 drops 4 times a day. Ionic mineral drops are added to the water drunk upon waking up in the morning, 30 minutes before lunch and supper, and at bedtime. Do this for 3 consecutive days, from day 1 to day 3. On the 4th day, increase the dose to 15 drops thrice a day, total of 45 drops. This is taken upon waking up in the morning, 30 minutes before lunch, and at bedtime. The dosage before supper is omitted. Do this for another 3 consecutive days, so days 4 to 6. On the 4th day, increase the dose to 15 drops 4 times a day. Follow the previous schedule and restore the 15 drops 30 minutes before supper, making the total number of ionic mineral drops to 60 drops per day. This is done again for 3 consecutive days, which is day 7 to 9. On the 4th day, increase the dosage of ionic mineral drops to 20 drops 4 times a day for a total of 80 drops a day. Maintain this dosage until you are able to control asthma for a period of 4 consecutive months. When symptom-free for a period of 4 months, you may begin to reduce the dosage of ionic mineral drops gradually until you reach and maintain the 10 drops 4 times a day or 40 drops a day. It is very important to comply with your daily water requirement very regularly to remain free of asthma. Taking ionic mineral drops alone is not sufficient. I would like to emphasize that purified drinking water is the only beverage of choice. For individuals aged more than 60 years, the dosage of ionic mineral drops must be increased after 5 days instead of 3 days as noted for the younger individuals. For individuals weighing less than 40 kilograms, begin the dosage of ionic mineral drops at 10 drops 4 times a day for 3 consecutive days and increase and maintain the dosage of 15 drops thrice a day until symptom-free for 4 months. Then maintain the dosage at 10 drops 4 times a day. For infants and children, dosage is computed at 1.3 drops per kilogram per day, then divide the product by 3 or 4 doses. Example, for a 2-year-old weighing 12 kilograms, 12 times 1.3 equals 15.6. Round this off to 16, which is divisible by 4. Dosage of ionic mineral drops for the 2-year-old is 4 drops 4 times a day. Administer this together with 60 ml of water throughout the day. Total daily water requirement for this child is 12 multiplied by 50 equals 600 ml. Once again, purified drinking water must be the beverage of choice. Aside from proper hydration using mineralized water, ionic mineral drops can be used for nebulization into the canister Add 1 ml of absolute distilled water and 1 drop of Ionic mineral drops and nebulize 3 to 4 times a day. Tap the back a bit stronger to shake off the sticky mucus to facilitate its expulsion. Proper hydration will also lower down the levels of histamine in asthmatics. Histamine is the chemical in charge of rationing water when there is a shortage or crisis. Water is the best antihistamine. Mainstream medicine links bronchial asthma to allergy. I hope I have explained how proper hydration and mineral supplementation help resolve bronchial asthma. Should you need any clarification, please visit any of our branches and product distribution outlets or send message to Facebook Ionic Minerals Philippines. Our staff will be more than willing to assist, clear out your doubts and queries regarding your medical concern. If you feel blessed by watching this video presentation, please share it with others so they may also be blessed. Thank you very much for spending your precious time watching this video presentation. Until we meet again, may the good Lord be with you always.
Thank you for watching our first video. So, again, we will pause for 5 minutes after each video presentation. So, for you to send your questions with us. You may write your questions via Zoom, via our Facebook Live, and as well as our YouTube channel, the Ionic Minerals Philippines. So, your 5 minutes starts now. Thank you.
Hi, I am Bruce Anderson, co-owner, CEO, and president of MRI. I want to inform our Filipino clients that Ionique Mineral Resources Philippines Corporation, or IMRPC, is the sole importer and exclusive distributor of MRI products in the Philippines today, after our sales agreement with Health Code International, or HCI, ended in 2011. For genuine and authentic MRI CMD that is known as the world's most powerful, 100% natural food grade sourced, health giving